So good afternoon, members of the committee, to allow me to testify on Senate Bill 258. This committee is no stranger to the versions of the APRN bill that have come before this one. Most of you sat through hours of testimony and heard from both sides on this issue. We're happy to sit here today and say we're confident the bipartisan bill before you, a compromise reached between our offices, the stakeholders, and the governor's office, will make it across the finish line after nearly a decade and a half of trying in some form or fashion. In case you've forgotten some of the finer details, advanced practice registered nurses, APRNs, are registered nurses with advanced knowledge, degrees, and skill. They include nurse practitioners, clinical nurse specialists, certified nurse anesthetist, and certified nurse midwives. We have a serious provider shortage in the APRN categories. Vacancy rates vary between 6 and 8%, according to the 2025 study by the Wisconsin Hospital Association. This shortage is felt all throughout the state, but it is particularly difficult to cope with in our underserved and rural areas, where healthcare providers are even scarcer. When the difference between a good outcome or a bad outcome is on the line, access to quality, dependable healthcare is everything. Allowing these highly trained APRNs to step in and ensure our neighbors are getting the care they need can be that difference. The APRN Modernization Act will put Wisconsin in line with the national consensus model of advanced nurse licensure. The bill will help provide regulatory flexibility and assist with removing barriers to allow these qualified providers to practice within their scope in the areas where they need it most. It will also provide clarity to the scope of practice of these important healthcare providers in comparison to other professionals in the state and their peers across state lines. APRNs are recognized in states across the country, including our neighbors in Minnesota as well as Illinois. Recognizing APRNs will help ease the provider shortage we feel across our state and make Wisconsin a more attractive place for these professionals to practice. I would like to take a moment and thank all of the nurse groups who have continued to advocate for this bill in their profession for more than 10 years, closer to 15. It's because of their dedication to providing the best care for their patients that we're here today. We'd also like to thank all the previous session authors from both sides of the aisle, their staff, legislative counsel, Legislative Reference Bureau for their assistance over their years, and I appreciate the opportunity to testify in this bill. And as I close, I just want to highlight some of the areas. So obviously the last two sessions, this bill made it to the governor's desk and was vetoed, and obviously I'm not here to relitigate that because we had very thoughtful conversations with the governor as well as the stakeholders involved. And I think the compromise that we came up with, not everyone is 100% happy, but I think that probably means we landed in a good spot. So the big areas in difference between the previous bills that had been vetoed to the one that's before us today, the three areas were the years of training and experience. The original bills were at 2, we are currently at 4. There were changes made to title protections that give the nursing board more teeth to ensure that individuals aren't claiming to be something that they are not. And then we modified language dealing with pain management, primarily so our nurse anesthetists who practice in underserved areas, especially in our critical access hospitals, can continue to provide care to patients. So with that, it's been a long time coming. I'm hoping that we can get unanimous support out of this committee and onto the floor and hopefully to the governor's desk so we can get this bill signed into law and move the profession of nursing in a better direction, but more importantly, and I can't stress this enough, this is going to empower providers to do the jobs that they are trained to do, which is take care of patients all across the state. So thank you. I'm happy to take any questions.